Oh, actually, I'm very glad with the question because pregnancy is, of course, something I really like to talk about. What I do see in the last couple of years that there is much interest about IBD, pregnancy and outcomes. But I think what is most important to really underline is that it's not the pregnancy itself, it is the whole process. So it starts already before pregnancy. So I think the preconception counseling, which is becoming more and more of interest to specific outpatient clinics, that's where we can make a difference. Because there you can tell your patients about maintaining their drugs, seeing whether they're really into remission, and that really helps to adhere also the patient to the maintenance of the drugs. And I think that's the most important part, and what we see is that there is now more focus also on that, not only on outcomes, but also starting from the beginning. I think that's very great, yeah. Well, yeah, we know much more about IBD. If you run around in UEG, there are so many sessions also looking into the pathology of IBD. And there are so many different factors that eventually will cause patient IBD. And I think we're now also more towards maybe even preventing IBD if that's possible at all. So I think more emphasis will go that way. For me, still the patient is very important, and although all those very basic research is really important, I do feel we still have to emphasize the problems our patients are facing, the fact that they are very fatigued. We still don't know what causes the fatigue. We still don't know how really to treat that. Things like social impairment, work productivity. I think still there's a lot to be investigated at the patient's side. So really the person behind the IBD. And I think that needs to be more emphasized in our research. I think the session Wednesday afternoon, which hopefully will be packed, but I can understand that people might leave UEG early, but that's more about certifying medical therapies. And the way we do it now is that we just look at the efficacy. We try to compare via network analysis the different options available, and then try to even make it more precision medicine to our patients while there is not much evidence at the moment. What you see particularly, there are several good papers out this year that is really trying to differ patients based on genetic background, response to treatment in relation to that. And I think that will even expand the next couple of years. So we are better able to define which patient will respond to which treatment. Also, what I still miss a bit is the safety issue. It's always about efficacy, but I think also the comorbidities and the safety of the drug is very important. But I'm sure that also will be incorporated in the more longer term research that has been performed or is being performed. Biggest challenge is, I think, how to really avoid complications on longer term. And complications does not necessarily mean surgery, because I feel that surgery is sometimes very important and will maybe save later complications. And then complications is not only colorectal cancer or fistulizing disease, Crohn's disease, or perforations, but also more the social aspects, as I told before, the fatigue, the social impairment, incontinence, which is still a problem for a lot of our UC patients. So, yeah, I think that will really summarize what I would really like to further follow up. Well, chairing the medical block is really a challenge because we have many societies involved. So we have really different viewpoints, but the nicest thing is that we have a multidisciplinary society, medical block. And what we really want to stress out in the next years is that how we can use that in our treatment of the patient. So for instance, how do we deal with children that become adult, and how are we going to treat this patient? How is the GP involved in this treatment? What can we do with the first line, and second line, and third line treatment? So yeah, what we have, I think we have a wonderful committee with a lot of knowledge, and we will hopefully get the opportunity to also give some of our knowledge back to the UEG Week